Uncle Trump has one shot, one opportunity to stop the death of America. One moment with the freedom of interest. But what do she with, y'all? Vivek's palms are sweaty, six-bit job.
So right now, folks, we have a special treat for you. We have Christopher Riley, who is our man on the street, reporting for the MAGA Kingdom Report this week with a very special guest. Her name is Julie DeVuono, who's also a former New Yorker like moi. She was a pediatric nurse, a middle-class soccer mom, and married to a cop. Now she's a convicted felon for providing falsified COVID cards to over 4,000 essential frontline workers facing losing their livelihood during New York's vaccine mandates. Her story is one of how a politically weaponized two-tier justice system exists, not only with applying charges to people based on politics, but how severely justice is carried out to those who do act actually outside of the law based on the politics of their crime. Is she a hero or is she a felon? You decide. This is part one of a great interview. Part two will be included next week. Enjoy.
Report. My name is Christopher Riley, and I have a special guest here, Julie DeVuono, and Julie is going to tell us a very interesting story. Before I get into that, let me give you a little background about Julie. She was a pediatric nurse in New York, middle-class soccer mom, and married to a New York City police officer. She's now a convicted felon for providing falsified COVID cards to over 4,000 essential frontline workers who were facing losing their livelihoods during the New York City's vaccine mandates. And keep that in mind, I did say mandates. Now, her story is one of how a politically weaponized two-tier justice system, which we've been hearing for the last 5 years, not only exists but in applying charges to people based on politics, but how severely justice can be carried out to those who act outside the law based on the politics of their crime. So with that, welcome, Julie.
Thank you.
How are you doing this morning?
Hey, any day above ground is a good day.
That's a good day,
or any
Julie.
day not in a cell is a good day.
Absolutely, absolutely. So I do understand how you got here, but I'd like our audience around the world to get a deeper understanding of what got you to this point, what has helped you get through it, and is it ever going to end? So I have a question. Let's talk about your cognitive dissonance.
Yeah. That's how it started. It's not like I just woke up one day and said, hey, I'm going to break the law. It had been a gradual process of seeing what I understand is called cognitive dissonance, where you know something to be true, but you're being told to accept a different reality. Mm-hmm. And being that I had worked as a pediatric nurse for almost 30 years, I had a master's degree level of education in nursing. I felt like I had at least a basic understanding of science and medicine. Right. I think most people would agree that, I wouldn't put myself up against like a pediatric brain surgeon or an epidemiologist, but I had 8 years of education and almost 3 decades of experience in a very hard science medical field. So there were certain things that I just knew to be true.
So giving out vaccines was something you knew a lot about.
I knew a lot about masks. I knew a lot about pandemic quarantine. I knew a lot about vaccination. I knew a lot about how viruses spread. That was all basic. And then when I had the government, not just the government, but our medical government, the NIH, the CDC, the organizations that I had always looked up to as being the authority to guide me into what was true from a science point of view, telling me that everybody had to wear surgical masks, everybody had to wear N95 masks all day, and that was going to protect us from COVID. Well, I'm sitting there like, wait a minute. I've had N95 mask training when I worked as a pediatric nurse in the hospital. You can't just buy an N95 and put it on. That you have to be trained on the proper way to wear it and when. And there's certain things, just to dive into a little bit of that, to give an example, we were trained that once you put the mask on and you fit it to your face, you had to do the sniff test, which means you would spray something, like a peppermint oil was what we used in the hospital. If you could smell it, it was not fit properly. Once it was fitted properly, you would open the door and go into the patient's room. You would set a timer. You had about 45 minutes before that mask stopped working.
Wow.
Because N95 masks are not, like we think, the average everyday person thinks the way the mask is helping is that it's a barrier.
Right.
That's not how they work. They create a static electric charge, and that static electric charge attracts the viruses, the germs, to the mask. So that's how they work. Well, after 45 minutes of breathing on it, the moisture of breathing gets rid of that static electric charge, so you have to leave the room and then put a new mask on and check the fit on that one. And another thing that drove me crazy is, for example, one time I was working in a hospital taking care of a patient with tuberculosis. Well, this kid's got tuberculosis, so I'm going to take that mask training very seriously because I don't want to bring that home. So if I do the fit test and I do the sniff test and then I go into the room and I set the timer for 45 minutes, guess what I'm not going to do 20 minutes in? Excuse me, I need a mask break. Oh, good, I feel better now.
So all
But
the
yet
masks.
I have them telling my son he has to wear an N95 mask for 6 hours a day at school, but that's okay because sitting at their desk to have lunch, they get a mask break to take their mask off.
Right.
And there's many, many examples. That's just the one that I give to say, when you know how vaccines are supposed to be put out during a pandemic and how you quarantining your entire population, even the ones that have a statistically negligible risk, at the same time as quarantining people that have true risk. I'm like, it was just this
Too much.
tsunami of,
Way
wait,
too much.
that's not right, that's not right, that's not right. And then when you're speaking up and saying that as a medical provider who you think you should know, and they hit you back with, you don't trust the science.
All right, let's talk about the science. Tell me about your spinning moral compass.
Yeah, so after I moved through cognitive dissonance, which is just this, oh, wait, that doesn't make sense, that doesn't make sense. Then it suddenly became a spinning moral compass. And that's just the phrase I use to describe how I was feeling when the vaccine mandates came out.
Right.
And I think part of it is I had a very different pandemic experience than most people. And it wasn't just me. All of us essential frontline workers, the cops, the firefighters, the EMTs, the nurses, the food delivery people, we weren't sitting home baking sourdough bread on Zoom for meetings. We were going out every day to do our job.
Right.
Even before the vaccine. So for a year and a half, every day we were expected to go out our door, go out into the world and do our job and get exposed to COVID and then come home. I think after a year and a half of that, we just had a different risk assessment of COVID. We had been going out getting exposed to COVID every day. Most of us had gotten COVID a couple of times and we did okay. So our fear of COVID, I think, was different. The level of fear was, well, I've been living with this risk for a year and a half, and now they want me to get an experimental vaccine. And I think what happened was a lot of us were like, well, we need a little time to make this decision, because they didn't just say, hey, we recommend you get this vaccine. You got an email,
Forced.
or you got a letter,
Right.
or you got a notification saying you've got 14 days to get this vaccine or you lose everything.
Yep.
Talk about going from hero to zero. For a year and a half, we were cheered in the streets every night in the city. Everybody would go out on their patios and applaud. Yeah, well, great. Now I've got a 14-day warning to make a potentially life-changing medical decision for myself or lose everything.
Whose ultimate opinion did you seek?
I did a lot of praying. had a lot of conversations with God, because what I was presented with was a choice. I had never stepped outside the law in my life. It was unthinkable. I hadn't even had a speeding ticket in like 30 years.
Shame
and
on
it's
you.
not because I'm married to a cop. It was unthinkable. But I was suddenly faced with, look, I got to vaccinate these people, and the ones that are just going to refuse, they're just going to have their lives destroyed, and I have to just stand back and be okay with that. Or
Cross the line.
I could cross the line, break the law, provide these people with their COVID cards so that they could keep their jobs, keep their families secure. And when I was in the middle, that terrible time when I was stuck between making the decision, I call it the spinning moral compass, because my moral compass had always been aligned with the law. It had never deviated.
Right.
Now, all of a sudden, I'm in a position where the law is pointing my compass one way, but my morality is telling me the right thing to do is in the opposite direction.
All right, so tell
And
me about the numbers.
well, you feel nauseous, you feel sick, you feel dizzy. It's like the worst carnival ride you're ever on, because suddenly every day I had dozens and dozens, and then it became almost like 100 people a day coming to my office begging me, look, I really don't want this shot. You have the means to help me. People aren't stupid. They know you could help me.
Right.
You could just squirt that in the garbage. It's just you and me in the room, and pretend that that happened, and give me the card, and I won't lose my job, and I won't lose my livelihood, and everything will be fine. You have the power to help me. Are you going to make the moral decision to do it?
Right.
And what I found was I was so desperate to get off that carnival ride, I needed to make a decision. The problem is, when I leaned towards the decision of following the law, I almost felt like, have you ever heard the term moral injury?
Yep.
They talk about it with soldiers coming back. They think it might be what leads to PTSD, where you are being forced to do something against your moral code, and you sustain a moral injury. And I started feeling that pain, and because I did give the COVID vaccine to some people. I even gave the COVID vaccine to some children, and I pray about that every night.
Right.
Because the parents, well, we want to see grandma, we don't know, So, and I realized this is how I'm going to feel. And that's not, I don't want to become the kind of, I've seen what that does to people,
Right.
and I don't want to become that person.
So
I followed the moral compass towards what I believe God was leading me to do, which was help these people. And as much as I hate to say it, it felt better. Like I felt more comfortable with that decision.
I understand there was a cost to these shots, right? So somewhere around $1,200 a shot?
No.
Okay.
Oh, you mean the going rate?
Right.
Yeah. So basically what happened was the government said to medical providers, we're going to send you these COVID vaccines. You have to give these COVID vaccines. You cannot charge anything for it because we're giving you the vaccine. And then the medical providers say, well, what about the extra staff? What about keeping my hours open? What about keeping my office open? They
Lights.
said, well, that's your contribution to the greater good. Okay, fine. So people would say, oh, well, the vaccines didn't cost anything. Yeah, it's true. To go get a COVID vaccine, it didn't cost you anything. However, if you were asking that provider to take on that kind of legal risk of falsifying a COVID card, there was a cost to that.
Right.
And at the time, in New York, the going rate for a COVID card was anywhere from $1,000 towards the city, closer to $500 on Eastern Long Island, because things are always more expensive in the city.
So in order for me to get a free shot, I was paying the provider nothing, but I was still paying for a card.
What you were paying for was that you were asking that medical provider to break
Give
the
me
law
proof.
to give you the card.
Okay. But if you got the shot, and you still signed that card, right?
Yeah.
But if you shot it into the garbage can, nobody knew the difference, and I walked out there with the same signed card, is there any harm there?
Well,
Other than the new law that they
I
created.
mean, the harm was, from their perspective, that you were going against what they had found to be their answer to how to get out of this pandemic.
Right, okay. But we know today that
Right.
there was no pandemic. They created the whole
Well,
thing.
when I was sentenced, what the judge told me, what horrible, terrible thing I did, was that COVID card was the blanket of security that people needed to be able to go out of their homes and go back out and end the pandemic, go to the store, go to school, go to work, and that they were trusting that other people around them had that card. That meant they were vaccinated, and I was ruining, I destroyed that blanket of security.
And I call that community immune systems, right?
Well, it's also the argument is, well, if you got your vaccine, and the vaccines are, as they said, 100% safe and effective, then what does it matter if I'm sitting next to you and I'm not
Correct.
vaccinated? The risk is on me,
Right, right.
so.
All right, so, I know there was a lot of money going down the pipe. You mentioned something that about around $1 million in 6
Yeah,
months?
so when I went into this, I tell people all the time, I was the last person to expect that it would add up to so much money. So what I did is I said, okay, if I'm going to do this, I don't want this happening during the day while I'm seeing my pediatric patients, because it was a pediatric primary care office. I don't want people coming in getting COVID vaccines or not getting COVID vaccine, getting COVID cards. Like, I don't want that. So I hired a like-minded ally and another nurse and a secretary that were part of this anti-mandate movement. And I opened my office to be for a second shift. So anybody who runs a business knows that when you're giving something away for free, it's not really free, you're doing it at a cost.
Right.
In order to do something at a break-even point, you have to charge something to cover your extra costs. So I sat down, I did a lot of math. I knew the essential frontline workers that I was helping couldn't afford. The reason they were coming to me is because they couldn't afford $1,000 for a COVID card. And so I thought, well, I can't do it for free because then my practice will lose money, so I have to charge something. So I did some math, and I found that the right number was about $200 for each signature on the COVID card, because some people had to get 1 COVID shot, some people had to get 3, some people had to get 2. So I said, okay, we're gonna do it per shot. So it's $200 per shot, and that would cover bringing 2 extra employees on and covering their salaries, keeping my office open for a second shift, and all of the ancillary expenses go along with that.
And this
So
was
I thought-
going on all over the state.
Oh,
You're
yeah.
You're not the
Oh,
only
yeah, no,
office because
everybody knew 6 different people that could get him a COVID card.
you mentioned out on Long Island for $500. So if I went to my doctor on Long Island and said, hey, doc, I have $500 here, can I get the shot and a signed COVID card, but keep
Right.
the shot off to the side? But that was a normal practice across the state.
You would have to know whether your
Well, understood,
yeah,
understood.
What your doctor might do is slip you the number of a pharmacist he knows and says, hey, call this guy, but don't tell him I sent you.
Right,
Like, it was
okay.
all of it. But yeah, so that was the going rate. So I thought, well, I'm charging less than half of the going rate. I'm charging the amount I need to do this without falling financially behind. And I might make, okay, am I gonna make any, well, by the time I pay the 2 extra salaries, by the time I pay the extra expenses, I expected to break even.
Okay,
What I didn't expect was the sheer number of people. I knew the people in my circle,
right.
but I didn't expect the sheer number of people who were so desperately afraid of having to get that vaccine that before I knew it, we had 100 people at our door every night.
So what was your total number? Approximately?
Over 4,000.
Over 4,000. And
in
how much
6
money
months.
did that bring into the facility?
It brought in 1.2 million.
And where did that money go?
Well, now,
Yeah,
they took it.
okay. But that was the practice's
Yeah,
profit.
I wasn't spend, everything was happening. It was all so crazy. I'm running 2 shifts, still a mom, still married to a cop, which is like being a single mom who can't date. It's not like, my husband's working. So I was just putting the money, stashing it in a duffel bag, putting it in a box, and saying, okay, I will deal with all this later. I don't have a second to breathe right now.
Like every other thriving medical practice in New York.
Yeah, but the money, it was just, the circumstances of the events just were so crazy, it overtook me. I didn't have time to think about it.
Okay.
So I set the money aside, and when they arrested me, and they came in with warrants, and they tossed my house, they
Okay.
found the money, they took it.
So this is when things start to get bad.
Yeah,
Tell me how that slippery slope went.
well, all I remember is we kept wanting to stop, but there would always be another See, New York rolled out the mandates incrementally.
Okay.
So it wasn't like there was one date that everybody had to have it. There was, first it was the New York City Police Department deadline. And I'd say, this is getting crazy, we need to stop, this isn't gonna end well. But then I would get, well, but the answer would always be, yeah, but the largest healthcare system in New York, their mandate deadline is 2 weeks from now. What about all the nurses?
So they were experimenting with how they can manipulate the public.
Yeah, so it was like, okay, well, we're gonna help the cops, but then we're gonna shut our doors 2 weeks before the nurses are due for their mandates. And then after we help the nurses, it was like, well, wait a minute, the teachers union in the city, their mandate is in 2 weeks. And so it just became this, like, every time I kept saying, you know what, this is getting crazy, I wanna stop, the answer would be, but what about this other population?
So it wasn't, New York State didn't turn around and say, we have a COVID pandemic, everyone needs to go out and take the shot. They did it by roles in society.
Rolling mandates, yeah.
So if I was the state, I would have said, okay, all my health practitioners, you're the first ones that are going to be affected. Why didn't they mandate you guys first?
They might have. I mean, everything is so hard to remember exactly
Understood.
which mandates came
Understood.
first. It might have been the healthcare providers first, it might have been the cops second, it might have been the teachers third. All I remember is that every time I kept saying, well, we need to stop, the answer would be,
A new mandate came
but what
out.
about in 2 weeks, maybe we can wait until after the next mandate. So then finally, I had a guy come into my office one day while I was seeing patients, and he said, look, I got my COVID vaccine from you guys a couple weeks ago, I'm here to get the second one, and he had a friend with him. And I said, well, you have to come back at 3 o'clock, we don't do this during the day. Well, I drove all the way out here, could you help me out, I don't, you know. And then I said, okay, and then when the secretary was like, okay, well, it's $200, he threw a fit. No, you don't understand, I'm not paying, in fact, you're gonna give me the money I already paid you back plus some, I'm gonna leave here with $500 in my pocket, you're gonna help my
So
friend.
basically, he was rolling you.
He was shaking me down.
Okay.
And he said, in every couple of weeks, I'm gonna be coming in with my friends, you're gonna help us, and you're gonna give me your payment, and that's how it's gonna work. And that's what I call my Breaking Bad moment, because all of a sudden, I'm like, wait, is this Breaking Bad?
So this is extortion.
I'm being shaken down for extortion and blackmail. I am definitely in over my head.
Okay.
So that's when I said, enough is enough. I told him, get out of here, I'm not playing, and
All
he
right.
wouldn't leave. And then I called the cops on him, saying he's threatening me with blackmail and extortion, and they that was their opening to say, well, maybe he's telling the truth. Come to find out, he lives in a $6 million house in Sag Harbor, and he probably had 50 doctors across the island that he was shaking down.
Okay, this interview should become a Hollywood movie because it brings out so many issues about the morality of our medical care system. And here's a woman who knows that these stupid mandated masks are useless, knows that many people did not want to take that so-called vaccine, an NRA concoction, which we now know leads to higher rates of heart attacks, kidney damage, turbo cancers. The research is coming out now about that so-called COVID vaccine. And you know, I have a lot of family members in the medical, you know, doctors, nurses, etc. And unfortunately, many people in the medical care system, they kept their mouth shut. They did what they were told, even though they knew that people were losing their jobs because they didn't want, for a variety of reasons, they didn't want to take this concoction. So I have a lot of sympathy for this woman. Now, it gets complicated because she was taking money, you know, being paid to give these falsified vaccine cards. So it is morally complex, but I think it's a really important story.
And it goes back to this, June 23rd of 2019, when New York State, when the legislators illegally took away a mandate to protect the autonomy of medical freedom in New York State. And it happened within 12 hours, folks, and a lot of us lived it. It was the reason why a couple of months later, my husband and I chose to move out and escape New York.
The trigger.
And a few months later, we know what happened. COVID came. So when that happened, it was 1 out of 4 states out of the United States that gave no option to the folks who live in that state. This is why the firemen, the police officers, the teachers,
Government employees.
were forced to lose their jobs and their pensions if they did not comply to an experimental drug. One of those people happened to be my sister, who was 13 months away from retirement and her full pension. And my advice to her, because she was losing her mind, was get out, screw the money, come move here to Pennsylvania. And you know what she did? Now, her story ends up pretty well because she was part of a lawsuit, because in the end, it was very unconstitutional what had happened to the residents of New York. But unfortunately for Julie, who's in this situation, and she too escaped New York 2 years ago, unfortunately, this case is following her, and she is still in the courts battling for her freedom over the situation. If you happen to be a great attorney, contact us. Please message us too, because she needs all the help she can get.
Look, think about the Germans in Nazi Germany who were faced with a choice. Do what the Nazi government tells you
The
to
regime.
do, or risk your life, risk the lives
Your
of your
family.
family members to do what's right. And she was faced with, look, the COVID lockdowns and mandates were, in my opinion, the imposition of fascism on our country. Most
Yep.
Americans went along with the propaganda, the fear propaganda, and thank God there were people like her who were willing to do something. But if Donald Trump had not been elected, we would be living in a permanent
Right.
fascist state right now. But thank
Lockdown.
God he turned his head. God saved him in Butler, Pennsylvania, and he gave America another chance for freedom.
Most of us would be in jail right now, wouldn't we?
You'd
Yeah.
have
Think
lockdown
about
after
that.
lockdown, and she saved 4,000 people from the jab, and that's untold on what they're not going to experience now. So all I can say is part 2 is next week, and this continues.
And I also just want to add, this is a reason why many of us in New York have a strong emotional attachment to Robert F. Kennedy Jr., which really has been bastardized in the media. The reality is that he was with us for so many years, fighting for medical freedom in Albany and taking a stand against, people think he's anti-vax. That's not what it is. He's pro-accountability. And that's why this story is not ending. Right now, the people of New York are fighting to reinstate their religious freedom. If you live in a state and you think that you have the freedom right now, you better watch your legislation to ensure in the future that a bill like that never sees the light of day, because I will tell you right now, your entire freedoms will be gone. Without bodily autonomy and the special relationship you have between your doctor, your God, and your child's health, you have nothing.
Okay, look, Governor Hochul has the power right now to put people in quarantine. Do not have to prove that you're infected with anything. There's no provision for legal to question why you're there or if you have any supposed disease. And there's no limit. There's no limit on how long you
You could be
stay
detained,
there
right?
in the quarantine camp. Okay, so New Yorkers, you might want to call Anastasia, and she might help you to. There's some good properties here in Pennsylvania. I'm just saying.
Will help anyone as long as you believe in the Constitution. Constitution-loving families, we welcome you here to Pennsylvania. And there's been a lot of folks that have come here because they can't leave their jobs or they can't leave their family members. But I'll tell you, take the leap of faith. If you're in a situation where you have to choose between the health of your child, your own health, and your job, take the leap of faith. You could always rebuild the money, but you cannot rebuild the
health.
life.
Amen.